forefront of the Black Maternal Health Week conversation here in Clarksville, Tennessee. Of course, conversations available to any and everybody who wants to see them whenever they want to see them. But we are here today to specifically speak to Dawn Stone on implicit bias in healthcare. And before we get into that, I want to go ahead and let Dawn introduce herself.
Hello, my name is Dawn Stone. I am a speaker, consultant, and coach that works with organizations and individuals globally to help them address things like issues with healthcare, issues with implicit biases, communication, their conduct, and specifically conflict resolution. So we look at conflict resolution as a total construct, as a way to help us through issues like this around healthcare, and especially the care of women, specifically Black women.
Awesome. Well, thank you so much, and thank you for being here. So I guess we'll just hop right into it. So when we talk about implicit bias in healthcare, can you help us better understand what that means?
Yeah, it's implicit bias is I'll call it a condition because it really is a condition for a lot of people. It's where we have thoughts and feelings that may be subconscious, some are overt, but they are directed towards people based on differences. And so differences can be anything from their race, their religion, their complexion, their socioeconomic background, where they're from, their dialect, whether or not they're a citizen of that community, and even those who have different identities around gender and ideals, and even neurodivergent people sometimes are subjected to these attitudes and thoughts. And what we see is these feelings sometimes exist outside of what should be normal behaviors, and they make their way into decision making, which ultimately impacts the health of the people that they're caring for, which may be a different makeup altogether of the people who are giving the care.
Okay. Okay. And so implicit bias, when people have those differences in the way they perceive these people, then like you said, it goes into the way that they treat them, especially when it comes to healthcare. So can you give us more information on how specifically this implicit bias in healthcare affects Black women's health, and then more specifically Black maternal health and maternal mortality?
Yes. And so I do want to introduce those of you who are listening to this. I want to encourage you to do a Google search on the 30-year study that's done at Boston College and Boston University, excuse me. And so they've been working on this since the mid 1995 specifically. And what they have done is said, let's look at all of the disparities. And they've basically come up with over 30 different disparities that impact Black women specifically. So what we see is when women of color, and especially Black women, walk into spaces to seek care, to seek comfort or pain management, there is a resistance or an implicit bias that's put in place to say, hey, you obviously can't be in this much pain. Therefore, we're going to make you wait a little longer. Therefore, we're going to make you get less of a medicine because you seem too eager or anxious to have your pain managed. And so what we find is this has created a social construct and a racial bias against women, specifically Black women, in childbirth, in just day-to-day, what we call preventative care. Also, on the other end of life, palliative care and end of life care, because a lot of times Black women will be the last ones to be referred to hospice to die with dignity. They'll be the last ones to get medication when giving birth to their children. They'll be the last ones to get medication or a certain type of medication, even for procedures that are done to them or on them. And so I'm going to be looking here. Racism is basically, it's a high cost. And so what we have found is that even in the state of Tennessee, and this has been the case for a very long time, is that 37218, which is in Nashville, so it's about 41 miles away from Clarksville, has one of the highest infant mortality death rates in the country.
Oh,
Okay.
wow.
Ironically, I grew up in that zip code. Okay. But what we also have is a number of health facilities in that same zip code or within a 10-mile radius of that zip code. So then you have to ask yourself, why is this happening to Black women? And so what we have found is that the implicit biases or the attitudes and the behaviors of a lot of people that go through medical school, that go through nursing school,
Yeah.
don't necessarily look like the people they are serving. And
Yeah.
as we become more diverse and more of a melting pot in the United States, and then we also have different identities. You've got LGBTQIA plus. You have people coming over here from different countries. Different religions are being held. This is supposed to be land of the free and home of the brave. But unfortunately, for Black women, we have to be brave to even go inside
Mhm.
sometimes. Okay, so let me give you one stat that's really troubling around cancer. Black women are less likely to get cancer, but if we do get cancer, we're 40% more likely to die from it than all white women.
Mm.
Okay? Now, when you hear that stat, it's like, well, oh, early detection, early cure. The thing is, we wouldn't have it.
Yeah.
And when we get it, a lot of times it is late. And
Yeah.
why is it? Then you have to back it up to all the other social constructs,
Yeah.
okay? Lack of equitable health care, period,
Mm.
lack of transportation to get to the best facilities for those services. So, for instance, a lot of the care that we could get from a cancer standpoint, if you're not at Vanderbilt in Nashville, Tenova can't give you that same care.
Mhm.
And then you also may need to get some of these clinical trials. And they talk about how Black people are resistant to the clinical trials because it goes back to time. The whole study of gynecology was built on Black enslaved women's bodies.
Yeah. Yep.
So, in understanding the history of this country and the things that our ancestors went through, especially our women, you have to understand this was done with and without anesthesia
Mhm.
majority of the time. So we're talking PAPs, all the things, childbirth, removal of
Pregnancies.
things, all the surgeries, all the practices were done on Black and enslaved and free women as well. A
Yeah.
lot of the experimentation. So even for cancer, if we got to get the top and the greatest people that have this cutting edge research, we generally would have to go outside of the state of Tennessee. You'd head to Ohio, you would head to Boston, Johns Hopkins University up in that corridor. You'd head to Harvard. You'd head out to California, Kaiser Permanente. You go to the big mega places that have the knowledge, air quotes. But again, those people are not people who look like us,
Yeah.
right? And so when you're faced with this, trust is an issue. So a lot of us do not enter clinical trials just because of the trauma of the history. You know,
Yeah.
one generation is impacted by seven. And I've been fortunate enough to track my seven generations up.
Yeah.
I
Yeah.
want more, right? I'm trying to go
Yeah.
all the way to the transatlantic slave trade. I want to know where we specifically touched the ground and how we ended up a collective of all these different tribes
Yeah.
and also part of colonized group, right? But
Yeah.
when they see my skin and I walk in, I'm a Black woman. So they
Yep.
don't see my degrees. They don't see my bank account. They don't see even my birthing plan. And
Yeah.
so we Black women have to understand that, you know, there is a discrepancy. There is a injustice against Black bodies being regulated, even from the time when we first started studying medicine here. Now, if we go all the way back, we know the original doctors were in Africa.
Yeah.
And so, whoo, that's a whole nother thing. I'm gonna stop. Let me let you add. I'm not gonna go there, but the original doctors were in Africa. All the hieroglyphics and all of the evidence is there. So if you want to go study Kemet and all the others, you got it. I'm gonna
Yeah.
leave it. I'm well.
No, no, I really appreciate everything you've given because I think that historical context is very important. Because like you said, there's always studies that point to the fact that Black people are not really present in clinical trials, and that's for more reasons than one. Because number one, we're not really sought out. So let's say that. But also when we are able to go, it's like, well, I'm not going because I know someone a couple generations removed that was a part of the Tuskegee experiment, and guess what? That didn't go well, you know what I mean? So I totally understand. So when we talk about implicit bias, we have to, in like you said, really consider the way we are seen, but also I guess just the historical relationship between Black people and the medical profession. And so
Mhm.
just like you said, so that the way that translate is less concerned care for our pregnant women, for our Black women, or
Mhm.
should I say Black birthing people? Because but
Yeah,
yeah,
the diaspora. And it's
yeah,
funny you say that because I was just reading earlier today too. There are 15 different relevant studies, and you can go and Google them all, around implicit biases in the healthcare system and how color plays a part. So, colorism as a construct was created by a European male many moons ago, and it was used to classify people who came over to this country and the islands because they
yeah,
dropped off at different spots.
yeah,
And so even in that class and caste system, they still use color as a determinant,
mm,
right? And so when you think about that, in fact, in these 15, yes, 15 different studies, they talk about how in healthcare, even down to the shades of people who are Black, brown, Indian, Native, we have the exact same type of disparity when it
mhm,
comes to the biases associated by color. So even the two of us will be treated differently historically and today,
yeah,
differently based on the shades of our Blackness.
yeah, because colorism is a terrible but real construct.
It
Yeah,
is. And
goodness.
so I don't see color. No, please see color
Yeah,
because
I
that's
need you to.
on me.
Yeah. Yeah, exactly. Yeah, I don't wanna exist without that part, my color, right? Because that's a part of me in my lived experience. Goodness, I feel like you might have answered all my questions. And so we know that there's a huge disparity in the outcomes for Black mamas and their
Hmm.
and babies, right? Because even Black infants are more likely to die than white, infants after birth
Yeah,
and also during birth, I guess. And
yeah.
so with that being said, so just for those who may not have been able to follow, can you just in very clear terms, just draw the line from implicit bias to health outcomes?
All right. So an implicit bias, I'll give you a couple of examples in the healthcare space. And so we'll talk, since this is all about maternal health, we'll go from that lane. And what I will also do is share with you through my own story, because
Yeah,
I am one
yeah,
who happens to be a Black woman who happens to have three beautiful kids. And so an implicit bias is I was a military wife. Okay. So you think about all the identities. So implicit bias is, remember, an attitude and a thought that may be subconsciously passed on through your decision making to other people based on some preconceived notions, a value that you have, a past experience you've had, and really no known true data on the person. So it's like
right.
perception, right?
Yeah,
And so when I was in California as a military wife, moderately young Black woman, so I was in my 30s. So the first thing I was told I was too old to have kids. I was 32. Okay.
yeah,
My nurse was a male nurse who was also non-Black, who told me I was having a contraction for my son. I had an emergency cesarean, first of all, with my second daughter. So I almost lost her multiple times. And he told me, bend over, you're going to be hurting anyway. And so literally doing an epidural on me and not giving me the grace of being a pregnant woman who was in the middle of a very intense contraction. One of the issues with implicit biases in healthcare is that they feel that Black women overestimate their pain
mhm,
or that we have a high tolerance of pain.
right,
And so with that assumption, he went ahead, bent me over, put the needle in my back. And if any of you have had an epidural, that needle's about that daggum long. And so at any time, he could have slipped and we would have a different story, right? I could be
absolutely,
paralyzed, all these different things. So that's an implicit bias he had. I was too old, I was Black, and I wasn't really in no pain, like I said, because I'm being pain anyway. And so he went ahead and went forward with an action. And luckily, that particular time, I was okay. All right. Another part of the implicit bias, as the story goes on, I wanted to get my tubes tied. I was in San Diego, California, pretty diverse. We were a well-to-do, actually, we were top, what they say, according to the numbers for Black families, we
mhm,
were a $250,000 family. But when
yeah,
we come in military, they don't realize that I had my own career and I was the big money maker. I was making 150 my daggum self, right? And so
mhm,
they don't know that. I had a birthing plan and everything else. They did not follow anything. So that's
mm,
another form of implicit bias because I didn't get my tubes tied. And because they failed to tie my tube, they just told me, well, you can just come back and get them tied another time. And I was like, oh, that's two cuts. So I had an emergency stitch, a VBAC, which is vaginal I attempted a vaginal delivery after a cesarean the first time, failed. I was in labor for 10 hard hours. They put my machine in, my Pitocin was in wrong, so I was feeling all the contractions. So that type of implicit bias, and they
Mm.
played it off. And so a
Yeah.
lot of people that in an effort with people who are not identifying with any part of you, they kind of
Yeah.
just went, oh, well, we'll fix it. No one ever addressed that.
Yeah.
And my
Yeah.
entire team was white, and I had one Asian person. I had one Asian person, and everyone else was white. The majority were male delivering my baby. Okay. And I had a midwife. They didn't even call her. So I didn't have representation.
Oh,
Okay.
wow.
All
Yeah.
right. So here we go. So that's an example of how, their attitudes and thoughts about me, I was annoying them, right? I
Hmm.
felt that I was annoying them. So I was suffering in pain. And I didn't know that I wasn't supposed to feel my child until the doctor came down and pat her head. And I said, wow. And they looked up and they said, you felt that? I said, yeah, every bit. And they were like, left the room, came in, and that's how I found out that no one connected my Pitocin. So for 2 hours, laying there with full pain, and I wasn't supposed to. This was a
Mm-hmm.
10-hour deal, right? And so when you think about how people treat others in implicit bias scenarios, people cannot find empathy in the other party. And when you can't find empathy in someone that's outside of you and your experience, it makes it a hard sell for us.
Yeah.
Okay.
So in that instance, you
Okay.
ended up suffering because somebody couldn't connect with your humanity because you didn't because
Correct.
because they had a bias about who you were, what you look like, all of those different things before they
Mhm.
ever well, I guess they never ended up having that conversation with you, so there's no way they had known at all, so or would have known at all. Dang.
And
Okay.
that what happens with us and what that does is just think, I want y'all to think about it. When we talk about the implicit biases and the entire social construct of racism in healthcare, we have to remember it negatively impacts Black women more because it causes more harm to our bodies. So we
Mm,
suffer trauma. And so the trauma of me almost losing my child multiple times, having to have this needle stuck in my back, and me actually having sciatic issues a little bit later, that's a whole nother issue. Not being able to have my tubes tied resulted in me getting remarried, and I now have a 6-year-old at 50. That wasn't supposed to be the case. And had
yeah.
they followed my birthing plan, which was on file, which was also in a binder with me at the hospital that no one followed, that's how you see the attitudes and the behaviors of people who are unlike you, not really feeling you. And
'Cause
so that's conscious and unconscious because there's a part of that that goes, I'm telling you things, but you're just not feeling me, Juanita. Do you
so at
see?
that point Yeah, so at that point, it's really just a complete disregard for you at
Mhm.
all because it's not like you went in and was like, "All right, do what you want," you know? You spent time and you put that plan together, and there's no regard for that plan, for your baby, for your spouse, whatever your wishes were at all, and it's all based on what the preconceived notion of you would have been, this ideal of who you are and what you may have wanted and what your situation would have been, and the fact that you're not feeling pain, obviously. So, yeah.
Yeah.
It's a hard situation.
Hmm. And so they also found in a lot of these studies is that the highest number of what we call incidents of implicit bias comes with patient and
Mm,
provider relationships. So
mm,
I'll say some people don't have bedside manners, a lot of them don't. And so actually I've started training, ironically, this year, specifically this year, because in 2016, no, 2021,
mm,
I had a COVID related stroke. And I also experienced the exact same thing, but it was the trauma of all of these experiences finally catching up, right?
mm, yeah.
And so my doctor said, you're one of the lucky ones. You lived, but you also were lucky because you had what they call a mini stroke due to stress. And so it's all the things that have happened. So I've had two emergency cesareans. The third one was a Schedule C. My son was 10 pounds, 14 ounces. Okay. I decided to be the first cut that day. Why? Because I had a better chance of getting fresh eyes and have fresh hands on me. And
Yeah.
so, Juanita, I will tell you, I also, since the pandemic, know 3 mothers personally that have died in childbirth that
Mm,
were younger than me.
mm.
One was 25 years old,
Oh, wow.
the one
Mm,
was mid 30s, and the other one was like late 30s, and I was 44. You look at all of those things and you see these type of disparities. I'm in this space on purpose. So I do a lot of health, mental health,
yeah.
emotional intelligence, because this is what's needed to reverse a lot of that implicit bias. You got to manage your ABCs. What is
Mm,
your attitudes is tied directly to your actions. And so, me and another colleague of mine in Nashville, I'll give her name, Kia Jarman, is amazing, because what she does is we look at the epigenetics associated with this type of work and why it's important for us to go into the medical classrooms, talk to the residents, talk to the doctors,
yeah.
talk to the social workers about this space. I worked in hospice, and that was my job. And so I took that job very seriously, because
Yeah.
again, I am a what? Example. I
Yeah.
am because somebody finally cared. And
Yeah.
even for my daughter, that was huge. I had what, her name was Joy, and my nurse overnight, my first night in the hospital, was named Joy. And I looked at Joy after I'd had that wild experience with all those men cutting me open. I said, Joy, I got to get out of here once as soon as I can leave.
Mm,
So, me, like a lot of other Black women who have experienced these implicit biases in the hospital and have their faculties, no, we got to get out as soon as possible. So, again, that's that trust factor. And so we see in the treatment decisions, the treatment adherence, the relationships in and outside of the office, all of that impacts patient health outcomes. And we as Black women have more fibroids, fibroid incidents, fibroid surgeries. Let me get all the others: diabetes, hypertension, asthma, and heart disease.
yes.
Number one in all of those areas, and all of that is impacted by the way we are treated when we come and when we don't come to the hospital
Mm.
and our facilities.
Yeah. Oh, wow. Well, it's almost overwhelming, but I think it's one of those things where it's overwhelming because you know, and it's also overwhelming if you didn't know, you know what I mean? So it's like it's a lot to deal with. And even as you're speaking about your experience, I remember mine, and it's one of those things that really just kind of unfortunately reminds you that more of us deal with this than we know. Everybody may not tell their story, and sometimes I think we forget how
Mhm.
I think sometimes when you get past it, you're like, okay, well, I'm out of it now. So, whew, but not realizing that one extra little whatever they have done or overlooked, like that could have been your life too. And it's unfortunate. But I'm glad you're definitely we are beyond ecstatic that you are here to share the story and really just here to not just share the story, but help to make the world and this space a better place for everyone. But speaking on behalf of Black women, I want to say thank you.
Yeah.
I guess just to kind of wrap it up, just because I feel like you've given us everything that we need. Like I really appreciate you the way you made it real and let us be able to visualize what that looks like and how we
Mhm.
can recognize it in our lives. And so I guess my one last question is when if you find yourself in this situation where you're dealing with someone who may not be treating you the way you feel you need to be treated in this space or with the bedside manner or whatever, what is your advice to that patient or to that loved one who may be witnessing that?
Yeah, that's a very good question. So for number one, I always say no before you go. So before you go and have anything, in fact, if you want to hear and look up this stuff yourself in these studies, one study I want to recommend is the National Healthcare Disparities Report. It talks about, white patient interactions and how they are treated better, given more options, given the best of the best,
Yeah.
and dominant like communication styles impact us. And
Yeah.
so I just can't talk to you, Juanita. I just can't do this, that, and the other. And so therefore you go without, right?
Hmm.
But that report will show you that the quality of care goes to white people first, and then everyone else, and then we're on the bottom.
Hmm.
Okay. And so that is a real problem, because that makes us have higher incidence of early death due to heart disease, stroke, Diabetes, even Black women over 55 are diagnosed with diabetes more after 55. And then what happens, they'll say, oh, well, you didn't do any preventative care. But a lot of us never got the care to begin with because we didn't know it was a problem.
Right.
And there are dyes and things and medications that we can and cannot take. But if we do not have a well equipped or well versed and a culturally competent healthcare provider, we
Yeah.
must move to another space. So when I teach this, in fact, I do a lot of this in Nashville for the Urban League. I have a whole series around health and emotional wellness. And
Right.
we talk about making your team. And I'm gonna tell you, be very honest with you, my team is looks like me. My heart doctor is Black. My primary care physician is Black because I did have a white woman who has been my care person for almost 17 years, but she's relocated, but she was culturally competent. And what I would do is ask my Black doctors about what she prescribed and what she said. No kidding. Because the way we are made up is different. My therapist is Black. So,
It is
it's
important. Yeah.
important to have culturally competent and culturally relevant people. Even if I don't have a Black person, I will get a person of color
Yeah.
or female who is competent and conscious of who I am as a person. And
Absolutely.
and I'll tell you, for those of you who are listening, if you're like, I don't know where to find these people, go and look it up and ask for referrals as well. Look
Yeah.
them. Okay. And if you find that on the very first date they're sitting in, the date is your trip to their office. But
Hmm.
that's what the implicit bias is. So if they're constantly doing this and they're never giving you eye contact, clue. If they're doing this and saying, oh, well, you're predisposition for this and you this, that, and the other, clue. Move around.
Yeah.
Because what to do is to write up a whole bunch of prescriptions for you because they may be getting kickbacks. And so that's why I tell people know before you go. If you have been told you have a condition, find a healthy way around it. And you can ask those questions, Juanita. So like my family has a history of a lot of stuff, right? My family has a history of a lot of things. And so it's like, okay, hypertension. What are you going to do about hypertension with me right now? Right? So
Mm.
your have to be preventative and they also have to be holistic in the care for you. If they're
Right.
not do that, seek a second and sometimes a third opinion. So, and I want to tell people, do your research on those people. If they have any sanctions against them. Oh, well, such and such just out to get me. No, ma'am, no, sir. Pay attention to those ratings. Make sure they are certified. And you know what else is happening? A lot of people are getting, and these moms are dying because of mommy makeovers too.
Oh,
Okay.
yeah. Yeah. Unfortunately. Yeah.
Okay. That also impacts you threefold because you've already gone through the trauma of childbirth mothers. And now you're about to go and take childbirth and suck the sides out and nip tuck. And your heart and your body may not be able to tolerate it. And maybe your uterus is still contracting because you have a breastfeeding child. And so when all that opens up, that means all the world gets to come into your body and your cavity as well. And then your heart is trying to keep up and all the systems start shutting down. So
Yeah.
we really need to be aware of who we are, what we're about, and what we're putting in our mouth. And I'll say one last thing: eat right. Anything that is processed, don't do it. I'll be very transparent. I exercise more than most of the people in my family, and most of the people I know who are 50 in their 50s. I'm in my 50s. I had a child at 44. Until I had that stroke, now everything else is catching up, right? Since the stroke, I now have hypertension. I now have cholesterol. I now last year have diabetes. You know why? I stopped moving. So one of the things that they will talk to you about, and I couldn't move because I had a stroke. So I literally had to learn how to walk and everything again. Had to how to talk and everything again. So I'm going to tell you, Black women, take care of your body and own every piece of it, meaning everything that goes into your mouth. So right now I'm in the process of reversing
Yeah.
all tests in my body. And so by this time next year, I will be on zero medication because at 44, I didn't have medication. I did
Yeah.
not take medication until that stroke.
Yeah.
And so look at healthcare. I know this isn't going longer than we wanted to, but when you're looking at healthcare disparities and that implicit bias, Now every doctor says they want to throw stuff down my throat, which means my kidneys are now not functioning the way they were supposed to. Do y'all hear me?
Yeah, I see what you're saying.
I
Yeah.
was perfectly healthy, capable 44-year-old. One incident can take you down the hill.
And if you're
And
not careful, yeah.
mhm,
And if you're not careful, like you're saying, there's no longer that holistic care. There's the how many pills can we throw at you to reduce these symptoms versus how do we make you, yeah.
mhm. And so I will tell you, giving you some hope. Since I've started eating even better. So the thing is, I've been vegan, I've been vegetarian, I'm that chick, I've run half marathons. Genetics, and there's a report that you will see at that Boston report that says it's not genetics, it's systems.
Mm,
It's yeah, they say it is the system, it's society, that environmental that has
mhm.
come into you where you pushing everything down and
Yeah.
people aren't giving you the things that you need, you're not taking a break, it will kill you. So let
Mm,
me stand here as a testimony. It will kill you if you let it. So
yeah.
now reversing everything. So my blood pressure's down 30 base points
That's a
within
lot.
within a year. This is within a matter of months. This is in 2024.
Mm,
Okay. So my blood pressure already changed. So
yeah.
now taking me down on some medicine. Okay. So
Yeah.
remember, your cells take at least 23 to 45 days, depending on what your system's been doing, to
Yeah.
change, right? So 23 good days, change all your cells over, clean yourself out. You need to get sleep. 7 to 9 hours each night is the only way your cells can keep up and continue to shed the old ones. So
Yeah.
you do a combination of good eating and rest, and you will see you earning more years in your life.
Yeah.
So I prematurely control as much as you can, and you can control this. And
Right.
you're that's
Yeah.
it.
Yeah. Man, you have no idea how much I appreciate you being here and just sharing that information. I well, I'll just say again, thank you. I appreciate not just this, but everything that you do. And so when we put this out, we'll make sure that we share your information, y'all. This is Dawn Stone, the conflict chick. So definitely book her for all of your needs. And I mean, she is well, you can hear for yourself. So so are there any last thoughts that you want to leave the people with?
Yeah, just mind your ABCs, everybody, okay? Your A's is your attitude and your actions. Your B's are your beliefs and your behaviors, because these are things that are given to you and things that you've acquired. It's a part of your conditioning. And the C is your conduct, right? Your
Mm,
communication and your conflict. So if
mm,
you make ABCs, even if you are a healthcare provider, even if you are aware and consider yourself empathetic to those, just understand that your brain is designed to protect. Your brain is designed to keep and hold on to the memories that are already there. So you may have to unlearn and relearn some new habits and some new behaviors. And some of those behaviors is to be able to take care of your whole self and to also own when you are wrong. That's
mm.
it.
Thank you. I appreciate that. Thank you so much.
You're
Y'all have
welcome.
a good
Have
one.
a good Bye.